Saison. You should have written your surname. Anyway, thank you very much. The audio
Yes,
is very
I'm
clear
trying
on
to
your
look for a way to actually change my my name setting here.
Okay. Okay. Thank you. Okay, so I got that marked, Landry. So how about our friends from Thailand? Hello. Do you have your audio? Or you could just try typing on the chat box for our friends from Thailand. But I think they're having a problem. How about Muhammad from GIZ? Hello, Muhammad. Could you try your microphone? Hello? Hello?
Hi, can you hear me?
Yes, very well. Could
Hi.
you just give a short introduction about you? Hello?
My name is Mohammadullah. I'm working in GIZ as a technical advisor. My core responsibilities are to provide technical support to the Ministry of Health in Bangladesh. And I'm working with two software, DHS2 and OpenMRS, for the Ministry of Health in Bangladesh.
Okay, thank you very much. So, Muhammad Ula is a regular participant of our AHIN Hour. Thank you very much for your short introduction. How about Esther Indriani? Hello, Esther. Could you try speaking on your microphone? Hello, Esther. Hello. I think she has to change her settings, or we try to do that later. Okay. How about Dr. Joshi? I think we're finished with Dr. Joshi. We still have others who are coming in our meeting room. Raj, are you still there?
Yes.
Would it be fine if we just give 5 more minutes so that others would arrive in our meeting room? Okay.
That's great. Yeah,
okay.
I have enough time. Yeah.
Okay. So how are you doing? Are you in India right now?
Yes, very much.
Okay. So I saw that many of those who would like to attend this session are coming from India. So were you able to also invite others from IWG?
I did have a call with Elnush, Vaibhav, and David, and I shared. That's why we have included a deck on the eHealth toolkit. Maybe because of the time difference, I don't know if they can join, but they will keep the join.
Okay. Yeah, we're during this season we're having a problem. I mean, during this times we're having a problem with that time because some Muslim countries are having their prayer times during this afternoon. But on behalf of those who are here, we would like to thank you because you really spent or dedicated this time to learn in this ANR. Okay, so I'm still checking on the audio of our Thai participants. I think that I suggest for those who are having problems inside the meeting room to just lag out and rejoin, because sometimes WebEx is having problems in this part. They have a lag. When you enter the meeting room, normally you cannot hear the voice of the presenter. So you still have minute or 30 seconds to 1 minute to be able to hear the voice of the presenter. We still wait for the audio of Dr. Chinmaya. She's still arriving.
Yeah, hi.
Hello, Dr. Chinmaya? Hello? Are you there? Okay, could you give a short introduction about yourself, where you're coming from, so that other participants would be able to know more of you?
Yeah, my name is Dr. Chinmaya. I am a public health and infectious disease expert. In fact, I was a research scholar at the University of Western Australia, and then I returned back to India and started a public health consulting company called Healthline.
Dr. Chinmaya, I think you should increase the volume of your audio because we cannot hear your voice. You're so soft. Okay. So we will have, hello, Dr. Chinmaya. We have,
Can you hear me now?
I hope you could speak a little louder. You're still soft in our part.
Okay. Can you hear me now?
Yeah, that's better. Okay.
Yeah. So I'm a founder of a company called HealthMind. We are a public health consulting company based in Bangalore, India. Hello.
Hello. Yes. Go ahead.
Yeah. And I've actually worked with Rajendra sir in the past, and we've known each other pretty well.
Thank you, Dr. Chinmaya. Your audio is very well, and I hope you would use your audio to talk later and ask questions. We now go with Dr. Rajiv. Dr. Rajiv is raising his hand. I think he has something to say. Dr. Rajiv, go ahead. I'm unmuting you.
Hello. I just wanted to do that I joined.
Okay. So could you give a short introduction about you, so that others would know more you?
Yeah, I am Dr. Rajiv Joshi, working from Pune, from India. I am a pediatrician and working in health informatics for last 20 years. Thank you. Hello. Hello.
Hello, Dr. Rajiv is one of our active participants in the network, in our emails and listserv communications. Thank you very much, Dr. Rajiv. I'm now muting you. We now go to our participants from Thailand. Hello. Hello.
Hello.
Hi. Hello. Good afternoon. Who is here in the house? Hello.
Hello.
Hello. Yes, I'm here. Could you try introducing yourself?
Gary.
Hello, Doctor. Is this Dr. Bunchai? Hello?
Oh, Vanchana.
It's Vanchana. Okay. Hello, Vanchana. Could you try introducing yourself to our participants this afternoon?
Okay. We are Thai team from Thai Health Information System Development Center. We develop a standard for health system in Thailand. Okay, thank you.
Okay, thank you very much. I'm very happy that your audio is now okay. We will now be able to use that for our question and answer portion. I'm very happy that we have a lot of participants this AHIN hour, so I will not do any testing of our audio. We now proceed to our session. Okay, so we now start our session. Just stand by, just stand by there, Raj. Good afternoon. This is Aliyah Evangelista from the Asia eHealth Information Network. Welcome to this month's AHIN Hour, our online learning and sharing session that happens every second Wednesdays and fourth Fridays of the month, 3 p.m. Philippine time. We are broadcasting from the National Telehealth Center in Manila, Philippines. Today is July 26, and it's exactly 3:15 in the Philippines. We are very happy to have with us today our speaker from Innovations Working Group Asia, that is Rajendra Pratap Gupta. Some announcements before we start our session. We're now using Cisco WebEx as platform for our meeting. And if you are encountering problems on your connection, please log out the session and rejoin the room immediately. Number 2, your mic will be muted during the rest of the hour. So if you have questions, you can type it in the chat box located on the right panel of your screen. Number 3, if you have questions, you can click the raise your hand button, and you can ask your question either directly to our speaker or to our chat box. Later on in our session, I strongly suggest that you use your audio so that there would be more interactions between you and our speaker. And number 4, after our meeting, do not forget to accomplish the evaluation survey of this AHIN hour. Once you accomplish it, we could send you more details, information, and greetings about our topic today. Raj and the team of the Innovations Working Group Asia are very excited to share with us current happenings in Asia and how innovations could be beneficial to our network. So I hope that you would be able to answer that evaluation survey so that you would have a copy of the resources that I will share with you. And lastly, please stand by for a photo-taking session so we can document your virtual presence in this AIN hour. I think this is what makes our meeting unique because we do not just interact with each other, we got to see and know more about people who participate in our meeting room. So if you don't have other business or other questions, I would like to give the floor to our speaker this afternoon. Please be an active listener and participant in our meeting room. You can type your thoughts in our chat box, or you feel free to raise your question to our speaker. So without further ado, here's our speaker, Rajendra Gupta of Innovations Working Group Asia. Go ahead, Mr. Raj.
Thank you, Alia, and it's a great pleasure speaking to the AHIN network. I have been a follower for since the inception of AHIN, and I really applaud the leadership provided by you, Alvin, and Dr. Bonchai for the AHIN network. It's probably become one of the most impactful networks for e-health professionals in Asia. So let me come to my topic, introducing you the Innovation Working Group Asia. So this was started by the UN Secretary General in 2010, and the aim was to harness the power of innovation and accelerate progress towards achieving the health-related Millennium Development Goals, which is in support to the global strategy for women and child health. So essentially, IWG focuses on women and child health. It's a global hub for innovation. It's a catalyst for initiating and enabling the scale-up of cost-effective innovation. Innovations across technological, social, financial, policy, and business domains, of course, all converge to two themes, that's women and child health. So what's the organization structure of the Innovation Working Group? So there is an Innovation Working Group Global that started 3 years back in 2010. This is maintained as a broad, loosely held network of partners with a small secretariat which works through partner organizations. The partners in the Innovation Working Group represent all the stakeholders, which is government, non-government, profit, not-profit, private sector development agencies. The global co-chairs for Innovation Working Group are the Government of Norway and Johnson & Johnson. There are thematic work groups that IWG identifies and works on with different stakeholders, and these are the thematic work groups. I'll talk about them, towards the later of the presentation. So for the global work group, this is some of the work. Probably you would have got an email, about this report at the AHIN network. These are the reports that the Innovation Working Group worldwide came out. The innovative medical devices for the health of women and children in low resource settings. There was another report, Fostering Healthy Businesses, Delivering Innovations in Maternal and Child Health. And this was a report for a sustainable business model. This is a report on private enterprise for public health, opportunities for businesses to improve women and children's health. And the last was checklist for the last kilometer, innovative strategies to ensure that life-saving commodities and information reach women and newborns at the moment of care. So why Innovation Working Group Asia? For those of you who have known IWG worldwide, IWG worldwide, operates basically with a focus on US and Europe. Asia in itself is large enough. There is a time difference plus cultural difference, and we are kind of a geography in itself. So there was a reason for them to say even the issues related to health are local for Asia. I mean, they are different for the developed part of the world, for US and the Europe. So this is the reason why IWG-Asia came out as a separate theme of IWG worldwide. It was launched on the May 28th, so it is little less than 2 months. Is today 26 July in Kuala Lumpur. It is organized as a work stream of Global Innovation Working Group. So now there are two working groups: the Innovation Working Group Global and the Innovation Working Group Asia. There are two co-chairs: Mark Kelly, Senior Operations Director, South Asia for World Vision International, which is one of the partners, and myself. We are facilitated and coordinated and supported by the Global IWG Secretariat, which is hosted by Partnership for Maternal, Newborn and Child Health at WHO Geneva, which is our small secretariat. We have a network of member partners. Also, that we have a coordinator based out of Kuala Lumpur, Terry Leong. She couldn't join the meeting today, but she is the person who hosts our Asia back office from Kuala Lumpur. So what are the scope of partnerships for organizations who want to work with IWG? First, as I said earlier, we are focused on innovations which are related to maternal and child health space. We are open to partnerships with public sector, private sector, and a part of the CSR initiatives of the corporate. So this is the scope of kind of partners we look at when we look at working with organizations. So coming to thematic work stream, so Asia has its own set of issues when it comes to healthcare. And internally, when we discussed about the thematic areas that we need to focus in Asia, we identified 4 of them. First is the ICTs, Information and Communication Technology, which is telemedicine and M-Health, because there's a lot of work happening and it holds a promise. Another issue and challenge is nutrition for healthcare for women and child health. Demand creation. And the fourth is South-South collaboration. There's enough of resources, frameworks, learning projects available within the South-South geographies, to collaborate and learn from each other. So what are the opportunities to associate and work? Asia has the largest number of women and children impacted by MDGs 4 and 5, that is child and mother health, are the real big issues for Asian countries. We can leverage existing innovation, like innovation in nutrition, innovation in ICTs. Universal health coverage as a part of health system is gaining ground in all parts of the world, and Asia is also adopting and moving towards universal health coverage. Those who are from India and know it, that now the government has taken a call to move towards universal health coverage. Thailand has a successful, model which is often referred in India in terms of universal health coverage. So this is also becoming one of the determinants. The technological innovations in Asia with M-Health and other parts of e-health are very critical to achieving the MDGs. I mean, Asia is the boiling pot of innovation, and most of the solutions available here are getting copied elsewhere in the world, are getting scaled up. So Asia will remain one of the key hubs for innovations, and we wanted to leverage that for ICTs in our Innovation Working Group Asia. There are growing economies in the region. I mean, 2 countries, China and India, are probably the fastest growing economies in the world. And most of the economies in Asia are growing because of consumption and export growth. And there is also a strong development and commitment towards corporate social responsibilities of those large corporations that serve clients across the world. What's the value to our partners, those who work with us? It provides a neutral meeting place for multiple stakeholders which want to work in the area of maternal and child health. Initiate thematic work streams based on priorities identified in the region. I said we identified 4 priorities, and at this time we will keep discussing how the situation evolves, how the priorities gain prominence in the region, and accordingly adjust to those priorities. As a platform, our innovation working group will be excellent in terms of sharing experience of stakeholders, stimulate ongoing and vibrant user consultation between stakeholders. You will see in the subsequent slides how you're going to do that. So membership, one can share experience, and firstly there is no fees to membership, for IWG. Anyone can join, and there is no fees attached to joining IWG as a member. Share expertise. There is someone who must be doing a fantastic work in some part of the Asia, which can be replicated in other parts. So you can share the experience and expertise, both that could be replicated. Share resources, those who wish to. Stimulate discussion on important issues. And support the cause, which is again mother and child health. So this is one very interesting, I'll not say product, but an offering that comes out of the Partnership for Maternal, Newborn and Child Health and IWG-Asia. It's called the ICT Preparedness Toolkit. Why this toolkit? Why do people need a toolkit? So there is first a big need gap when it comes to addressing the issues of mother and child health using technology, and there is a high level of interest between the providers and users of services when it comes to interventions which are related to reproductive, maternal, newborn and child health. Since technology is a recent development and there are many providers, many resources, but there is a lack of credible platform where you can look up for resources, for knowledge, for providers, and all this leads to a hesitation, when it comes from large governmental organization or others to start the ICT-based intervention. There is amount of skepticism that develops in. You want to address this, by saying, look, there is a toolkit you can use. But are these resources new, which are there in the toolkit? No. This toolkit has been developed from existing works and frameworks. We picked up learnings from like the WHO's work on developing applications for safe care and delivery. Can we use ICTs to improve coverage and quality of RMNCH interventions? Some countries are still facing phenomenal challenges in achieving MDGs related to mother and child health. We know in India we have the highest number of deaths related to mother and child health in the world. And there have been programs which still have failed to achieve the MDGs. We wanted to bring down the national mortality to 200, but we're still far off from that. Technology appears to be a kind of a solution, in enhancing or rather increasing in the speed by which we can, go towards achieving MDGs by technological intervention. So yes, it can. There is a clear evidence about what needs to be done. It has to be essentially a low-cost intervention that have been demonstrated to work. We know that technology-driven interventions, have led to decline of maternal mortality in some parts of the country in India, even in Indonesia. There have been successful examples. The partners want to come together in the multi-stakeholder setting to scale up, improve, or deliver more effectively these interventions. You want to see how ICT MS innovations can be leveraged in this context. So the reason I have dwelt on one of the thematic work groups of IWG-Asia within AHIM is because this is a network of e-health professionals, and this will be extremely relevant. It is not that we are not open to discussion on the other thematic work group. Those of you who want to come back and talk to us more on that can always connect with us on the other work groups as well. So the challenge, there's a lot of activity, there are different stakeholders, but there's no dialogue. I mean, you will see that when it comes to e-health and m-health, so there's no dearth of solutions. I mean, I call it there is a mismatch of technology maturity and organizational maturity. When it comes to technology maturity, I think we have solutions for almost every health problem that can be thought of. But probably there is a lack of organizational maturity. We aren't ready or prepared to use those technology innovations. So IWG works as a platform. We know that if not 100 or not 1,000, there are definitely a lot of m-health and ICT pilots. Not that many are demonstratively scaled up using, at state or national levels, but they do exist scattered. A larger health ecosystem that is more complex than innovators are sometimes used to. The community level systems are not the same as national level. There needs to be a platform to discuss what's working, where, how it can be integrated, how it can be scaled up, what are the challenges. Of course, it is not that such kind of solutions are very simple, because someone who develops is itself a low-cost provider, so you need funding. Someone who provides funding lacks the technical expertise to scale it or take it to other regions. There are NGOs who are offering to chip in, but there needs to be a platform to get them together into a dialogue. And that's what Innovation Working Group wishes to do. There are some critical questions that are not asked when there is a project that is initiated. So finally, what leads is that when you start the project, there is a lot of enthusiasm, but towards the scaling up, all dies off because of issues. So the response has been stakeholders review the ICT Health Preparedness Toolkit which we have developed. It's an instrument that encourages a dialogue between stakeholders and ensures critical questions are on the table which have been defined in the work group. It also provides access to resources from reliable providers which have been worked on. There are guidance, there are case studies, there are experts, FAQs to help the countries understand what needs to happen if they want to leverage health or ICTs for mother and child health. So this is a pictorial work group. We just put one of the clippings on the deck. What it does is brings healthcare innovators, operators, sponsors, and end users to the table. It took a couple of months to come out with this toolkit, and we had 20 plus experts from all over the world working on this toolkit. It guides stakeholders through a key logical process of exploring key questions. Before you start, you need to do scoping of the project, what you want to achieve, which interventions you want to work on, what are the existing resources, what comes next, how do you build a sustainable ecosystem. It encourages stakeholders to use tools, resources, and methods that already exist. But what we have done is we have all brought them in this workgroup. So if they are from WHO, they are from GSMA, they are from Health Alliance, and from Innovation Working Group, because IWG Worldwide has already been working for the last 3 years in this arena. So all this has come together in a single resource called Preparedness Toolkit. Focus on what can be done given where you are, and not what can't be done because we are not ready. This gives you certain questions at the starting point itself, so you know, are you prepared to launch that intervention or not. So this is about the toolkit, and now I get into my final slide. So it's a short presentation on what are the synergies between you who are participating in this AHIN-R and IWG-Asia. AHIN is a platform for e-health professionals from across Asia and probably beyond. IWG as a platform is working on developing the telemedicine roadmap for Asia. We have identified that one of the key missing points in the country's strategies is that they lack a strategic roadmap for telemedicine or e-health or m-health, whatever we may call it, or digital health rather, a better word. That they need a roadmap. So we are working on the roadmap. The first offering is the toolkit, and then we start working on the telemedicine roadmap. As members of AHIN, I think we have very passionate e-health professionals from the government, from the private sector, from the NGOs, clinicians. We can probably work together as volunteers to make this happen for each country. So suppose we have a group of professionals from India on this call, some from Thailand, some from other places. We can work together identifying the telemedicine roadmap for each country, which IWG will initiate. We have ITU which is already working with us on that, the International Telecommunication Union. And also that we are open to ideas for synergy. I mean, it's at this point an open-ended, it's like a two-month-old organization in Asia, but we need to map out our roadmap going ahead. So, and this is if you want to reach out to us to connect, you have our information, and and now it's open to anyone to ask. Alia, it's up to you now.
Thank you very much, Raj, for that wonderful presentation. Raj, could you try muting your audio so that I would have feedback on your end, because I need to open your microphone to answer questions. So thank you very much for let's just check some audio of our participants there. Thank you very much for a very informative session. I've learned a lot from IWG and how it could be a platform for, most especially the thought that it could be a platform for creating a roadmap on telemedicine in Asia. I am now opening the floor for our participants to ask questions and maybe discuss their thoughts on what has been presented by Raj. The most interesting part for me is that IWG-Asia has a lot of synergies with the Asia eHealth Information Network, wherein most of the efforts that we are doing right now and what IWG-Asia is doing could be harmonized together to achieve common objective of improved health-related goals in MDGs. Would it be okay if I ask our colleague from Nepal, Ms. Sushil Chandra Lekhak, to share her thoughts about what has been presented? Because I know that Sushil is part of the Koya team in Nepal. Sushil, I'm unmuting you.
Hello.
Hello, Sushil. Go ahead.
Okay, so I'm working for the Koya and WHO and Ministry. So right now we are planning to use some of these innovative information communication technology to improve the service delivery, and also for the improvement of this vital registration system, and also for this verbal autopsy of the death to establish cause of death. So at the same time, country is implementing telemedicine program, and there are some challenges. So we want to address those challenges as well. So from this group, I want to some sort of help how we can move ahead, particularly in the context of Nepal. We have a different situation, and what would be the recommendation from the group after a lot of piloting in mHealth and telemedicine is going on. So can we share some specific experiences that could be beneficial for the country like Nepal? So that's my plan to learn from this group.
Thank you very much, Sushil. Raj, you're still there. I think you could explain more of the preparedness toolkit that you have described a while ago, because Sushil is working for, I think, country office, WHO country office in Nepal. So maybe the preparedness toolkit would benefit them. Could you elaborate more on that?
Sure. Alia, can you hear me?
Yes, very well.
Good.
Okay.
So Sushil, I still recall the health minister of Nepal was there in our meeting in Manila when we had the high-level health ministers meeting, and we had discussed mHealth. So I know that policymakers are very keen. The challenge comes in the practical deployment at the ground level, which probably people like you and I can face. So what I would suggest you to do is, I would probably send you the toolkit for you to have a look at. And since Innovation Working Group wants this to be used at the ground level, you can use it, you can identify which are the key areas where probably you should start with when it comes to using mHealth. This will not only give you resources, but also the use and quotes from the experts in the area of mHealth, how to go about, what to be careful about. And probably we can work with you piloting this toolkit, in Nepal, and provide you with support that probably would be needed to make it, being used locally within Nepal. If that helps you, I think you have our contact details, and Elia would be probably sharing you the presentation, which will have the email IDs and phone numbers. And we're more than happy to work with you on providing the toolkit and the support for a successful Lung Health project in Nepal.
Okay,
Yeah.
thank you very much, Raj. Any thoughts, Sushil?
Yeah, I have one question that I came to know that there is one organization who is working in mHealth, that is also new here, Medic Mobile. So can you elaborate more info about the Medic Mobile? Do you have any experience with that?
Hello, Raj, were you able to get that?
No, I mean, unfortunately, I have no comment on that because, I can always come back on that if you want details, and if I'll probably send you details of that if you need, as you said, you want to learn more. I don't think we have that, company probably or person from the company on the call.
Okay.
But I can come back to you with details.
Okay.
Yeah. Awesome.
Sure.
Thank you.
Thank you so much. I think that's the most important thing that so far we ever achieved in this call is that Raj could maybe give Sushil resources to jumpstart the testing of the preparedness toolkit. Raj, just a question: when was this toolkit prepared, or when has this toolkit been already used?
So we are using it in two parts. One is in Africa, and then we are trying to use it in Asia, the two parts of the world. That's what we're trying to do. It came out last week. It's not been formally announced, and I think this was the forum we talked about it. Otherwise, we haven't talked to anyone on the public platform about this toolkit. And Asian is probably the platform where we announced about the ICT mHealth preparedness toolkit. So this is the first time it's in public domain, and we'll be happy to provide it to people who want to use it. Even the company that Sushil referred should be in the resources of the toolkit. We have made sure that it is exactly what he has tried to ask, and that's what we try to answer in the preparedness toolkit. So when someone has a query, he can actually look at resources and the experts' advice on the side in the toolkit.
Okay. That's excellent, because there are a lot of problems on maternal and child health in the region, and we really need to be strong on, most especially also to civil registration in vital statistics. So providing these resources to our network and being able to capture developments on how this was used would be a great help to our region. So with that, any other comments or questions? There we have Michael. Michael, I'm unmuting you. Go ahead. Hello, Michael.
Hello. Can you hear me?
Yes.
Okay. So from what I understand, the preparedness toolkit basically maps together health-related issues with technology innovations that we already have, right? Okay. So where can we download the toolkit, or is it available already online, or do you have to send it to us individually?
Yeah, Mark. What we can do is I can come back to you shortly, because this will be done through the platform of Innovation Working Group Asia.
Okay.
And we'll be formally making it available. We are just finalizing the entire content in terms of the text and all. The basic structure was ready, and we're just moving towards the last part of concluding the last proofreading and all.
Okay.
So we should be able to make it available shortly, and it should be freely available.
Okay. Thank you.
Okay, thank you very much, Mike. Are any other questions in our meeting room? I know you have a lot of questions, but you're not. We can type it if you want, or you could ask them directly to our speaker. Another thing I would like to point out, maybe while we're waiting for the questions of our participants, is that IWG is also committed on ensuring universal health coverage across Asia. And as you have said, Thailand is very strong on this. Maybe we could ask our Thai team on his or their thoughts about IWG working on this. Hello, Zhao.
Hello.
Hello, go ahead. Maybe you could share your thoughts on what has been presented regarding
Yeah,
UHC.
unfortunately, I don't know much about health universal coverage, but I think it's a good opportunity that to know about the innovation working group, working related with the AHIN group. Very interesting. Okay, thank you.
Okay. Okay. So all along I thought we were in the same page. But anyway, just an input also, the Thai national ID is one of the models for national ID system. And here in the Philippines, we're also looking on that as part of the as part to ensure universal health coverage in the country. So thank you very much, Zhao. Any other thoughts inside our meeting room? Maybe Raj, could you give us one of the most important thing you would like to achieve in this call, or your very key message in this presentation? Hello? Hello, Raj, you're unmuted. Hello?
Yeah.
Okay, could you give us one of the most important thing you would like to communicate, or the key message of your presentation?
Yeah, thanks earlier for asking. I think that's the best question to answer. See, as Innovation Working Group Asia, it's a loosely knit group with a common objective to provide as a hub for innovation, especially in two areas of women and child health that concerns every country in every manner, whether it's economy, whether it's productivity, whether it's longevity. So if you as individuals, professionals, see that there is a challenge and would like to contribute in probably 3 ways or 4 ways. One is if you identify a challenge where the solution could be innovative using technology, please do connect with us. We would like to work with you using that as a challenge on the table to be focused for a solution. The other side, if you are one of the providers who would probably have a solution that could be developed or you have developed that could be used or scaled up, we could actually help you connect the dots in being a part of our platform. And third, if you are implementing organization like we have a friend from Nepal, and you are about to implement a project or you would like to consider implementing a project, IWG could be a platform, where we could get you the rest of the 2 or 3 people saying, hey, look, we have this entire ecosystem. We have a challenge, we have a solution, and we have a solution provider. So we work as a platform, a meeting place, and suppose like our friend from Nepal goes to implement a solution and gets stuck somewhere. We'll be more than happy to use our platform, our resources and tools to help you, in the best way possible how to go about implementing it. That's what our goal is, and we are open to work with all of you. Since there are no financials or fees involved, I think all of our enthusiasts, who work in the area of technology-driven care, are more than happy to, come with us, partner, work with us, and let's use it as a platform to disseminate as much information as possible to make ICT interventions successful for women and child health.
Okay, thank you very much. Having said that, there is one of our participants who would like to ask. She has chatted her question, but I think it would be best if she would ask this to you in voice. Esther, go ahead. Hello, Esther. Esther, can you hear me? Yes, very well. Could you just give a short intro about yourself? Where are you working? And then go ahead with your question.
Okay, thank you very much. I'm working for World International Asia Pacific, and I'm here to represent Mark Kelly. I work as a maternal child health and nutrition specialist for South Asia and Pacific region. And yeah, I'm very, very happy to listen to the presentation. And I wonder whether we can get the link on the documents presented earlier. The 4 documents.
Yes.
Could you please send us the link?
We had sent the link to Alia, and it's there with Alia. And probably Alia, at the next step, what you can do is you can share the link to the 4 documents that Terry has sent you, along with the PDF file of this presentation. So all of the members of AHIN and the participants of the call can have a look at it and reconnect back with us in terms of you want to connect with any other specific documents or any project that you have in mind, more than happy to engage with you on those discussions.
Okay. Yes.
Wonderful. Thank you.
Okay. Actually, that's the most. After this call, I will be sending that. Or I will be sending another email about the evaluation of our call. And once you got that email, please fill out the form. And once you fill it out, I will be sending the links and other resources. That's why it's very important to accomplish the evaluation survey of this call, because we also want to know how much have you learned in this call, what are the things we could work for or we could work out more, so that we will be able to provide the answers to your questions, or we could be able to lead you to resources which you will find useful in your work areas. So any other questions we would like to welcome in our meeting room? Thank you also, Esther. So with that, if you don't have any other questions, I would like to emphasize that right now, the Asia eHealth Information Network is really being more strategic in identifying partners and contacting other groups which would be beneficial for the work of the network. Currently, we are keeping in touch not just with development partners, but with groups such as IWG-Asia, which could provide us not just resources, but not just fundings, but also resources which could help our countries grow more in their work areas. Okay, thank you very much. We're on 5 minutes before we end this session. Again, I am Aliyah Evangelista. Please answer that very short evaluation survey that I'm going to send to you. Would it be okay if we end this session with a short photo taking session, so that we could document your meeting or our meeting room? On my signal, I'll take a photo of our screen. Thank you very much for joining us this afternoon. There are a lot of things that are happening in our network, most especially at the 3 regional conferences that we are hosting on September, and the HL7 course, online fundamentals course that we are hosting and we are providing to our members. If you want to keep in touch with Raj directly, I could also send you all the email of our speaker this afternoon. Most especially to keep in touch with the toolkits that he has just provided. So are we all on? Raj, do you have a video component?
Yes, I do.
Okay. But I think your video is not on.
Okay. Can you?
I think I will be returning the presenter option to me, so that we'll be able to have that. So if you also have some topics that you would like to be showcased in our meeting hour, please do email us. We are very happy to cover it for you. So on my signal, this is your favorite part. For me, this is the favorite part, because we were able to tell our region that there are a lot of meetings that are learning and that are happening in our network. So 1, 2, okay, 1, 2, 3, smile. Another one, 1, 2, 3. And other participants, we have, I think we are 20 in our meeting room right now. There I saw Sushil, I saw Jao, and I think that's Kanlaya, or not, or Niramay, Esther, and Mark. So 1, 2, 3. Okay, thank you very much. Even though if you did not throw so much of your questions, I know we could keep in touch more with our speaker this afternoon. So that's it. See you all on our next Asian Hour. That's August 14 and August 23. We will be having more Asian Hour sessions this month because as we prepare for our September meeting. So please do keep in touch with our mailing list, and you could ask me questions and other resources you would like to have in this meeting. Thank you very much for coming very early, and we'd like to see you again in our Asian Hour. Thank you very much, Raj, and to the team of the IWG-Asia.
Thank you so much.